Hi everybody, it's Dr. Satey coming to you from Beverly Hills, California. Today we're going to discuss what to expect on the day of your tummy tuck surgery, as well as what's the recovery process from a tummy tuck. So when you get here on the day of surgery, you first get to meet our fabulous team. Subsequent to that, we start with one of the most important portions of the procedure, the preoperative markings. Why? Because that becomes the roadmap to my surgery. We plan everything out before we go into the operating room, so when we go there, we have a plan of action. We then perform our planned surgery, and then we start to think about what's our recovery process. Do you get to go home, or do you go to an aftercare? The determining factors of this is whether or not we're doing a 360-degree approach to your surgery. So in other words, are we working on your back? Are we doing upper, lower, middle back liposuctioning? Are we doing some component of a fat transfer? Is there some variant of an incision on your backside? If the answer to any of those are yes, you will have to have an overnight stay at an aftercare. Otherwise, you get to go home. So a commonly asked question that I get is, am I gonna be bedridden after surgery or can I walk around? And the answer is, I want you to move. I want you to walk around. Ambulation helps prevent the risk of you getting any blood clots in your legs. So it's really important to help circulate that blood. Mind you, I want you to go slow, I want you to take your time, but I do want you to move. That includes hours after surgery. As a part of my tummy tuck procedure, my patients get 2 drains placed. The purpose of these drains is to collect fluid buildup. Now these drains stay for about 2 weeks on average, sometimes a little bit less or a couple days more. It all varies from patient to patient. The last thing we want to do is take a drain out too early and have fluid buildup. It really helps to have those drains in. Now, if you're a traveling patient, I want you to stay local until your drains are removed. Now let's review our recovery timeline. We already said that at our 2-week mark, on average, our drains get removed. At or about your 4-week mark is when most of my patients resume going back to work. At 6 weeks, 80% of your body's tensile strength has been achieved. So at that point, I normally give the green light to my patients to start working out, exercising. And finally, let's talk about our post-operative visits. So I like to see my patients on post-operative day 1, just to make sure everything is going amazing. On post-operative day 7, on post-operative day 14, that's typically when the drains come out. Then again, at the 1-month mark, the 3-month mark, this is typically when we start to really see the results. The swelling has drastically gone down, the skin tightening, everything is there. And then again at 6 months and 1 year. And that marks the completion of your body's remodeling. So that's the recovery process, that's our timeline, and that's how a tummy tuck is done. Thank you.